I'm sure you as a mother, like thinking about the way that you speak in front of your daughters, is that something that's quite like when you're feeling poorly, and we're going to come onto the book in a second as well, but like how do you manage those things of going, I'm feeling poorly, but I'm also aware that I would like my daughters to, how do you speak to them?
Oh, that's a really difficult question, because again, it's different from day to day. I remember one day last year, I've always been a very active person. I'm one of those that can't sit still until night time.
Yeah.
So, you know, if I haven't got anything to do, I'm finding things to do. On a day like today, I'd find washing or something. And I remember my eldest coming home from school and finding me in bed because I was really not feeling well. And she knows that that's not me, and she didn't say anything. She came into the room, she pulled back the covers, climbed into bed with me and just cuddled me. And we didn't have to talk about it, and it was such a beautiful moment that I'll never forget. She didn't ask me, why are you in bed? And it's, you know, sunny outside, it's daytime, Mummy. I think, you know, with regards to talking to the children about things like that, they're a lot more aware than you know, we realise. But occasionally, I have had to talk and bring things up and mention things. For example, when I was first diagnosed and it was, you know, Mummy's not very well and I might get a little bit more poorly and I'm going to lose my hair, and those things were really, really difficult. But I was very much led by my daughter. I came home from hospital thinking, right, we need to sit down together and plan exactly what we're going to say.
They'll often lead the way, won't they?
They led the way, yeah. My eldest just said, on the day of I was diagnosed, she said, oh, Mummy, I need my cough medicine, remember? And I said, oh, your cough's gone now, you're fine, you don't need any more. And I happened to have just coughed because I had a cough from the lung metastases. And she said, oh, well, you need your cough medicine, you still need to have it. And I just simply said, you're right, Mummy does still need some medicine, and that's what the doctors are trying to do. That's where Mummy's been today. They're going to try and make me better. But in the meantime, I may get a little bit worse, more poorly, I might lose my hair. And that's how we told them that it just happened naturally. And I'm so glad that happened, because I think you can panic and be, oh, I need to, don't say that, I must say this. And actually, it just happened.
We had a fantastic Trekstock talks on parenting with young children when you've got cancer, and but they were mentioning your book, and which we've got a lovely copy here. And what Mummy's got it poorly. And what made this come about? What made you create this?
Basically, I've been a primary school teacher for the last 12 years, so books I find are a fantastic resource for anything. I would always look for a book, and that's exactly what I did. I came home from hospital and searched for books, and I found oodles of books. Some I looked at straight away and thought no, some I thought they're fantastic, but not yet, not for my children at this age. And I couldn't find something that I just wanted it to open up discussion really with them, so that they could say, oh, that's like you, or that's like so-and-so. And a parent at school sent me some things that she did for her children when her mother was poorly, just simple on Word, and I thought, oh, that's fantastic, you know, I'll do some of those. And it kind of was a bit more than words, and it went into a book. And I remember sitting on my sofa in my pyjamas, just typing away on my phone, and it just evolved really, and kind of went from there.
And it's interesting because we've been talking about language and finding language that is acceptable to us, and finding things that are accessible to others. And this is how you found a way to communicate with. Yeah. And can you remind us again, how old are your children?
They are 6 and 3.
6 and 3.
The language, it's a very fun story. It's a rhyming story told through the eyes of my eldest. I avoided using the C word because there's so much that comes with it. Like we were saying earlier, cancer isn't just cancer, it's very different for everybody. And I didn't want that, your mummy's got cancer, or my auntie has cancer and this happened, and that fear. They do now know the words, they've heard it from other people, they've heard us discussing it, and it's not scary to them, it's just normal. Like I said earlier, my 3-year-old can be playing in her kitchen and talking about breast cancer as she's cooking her sausages, and, you know, so I feel that it was right for me, but everybody is different.
Yes.
And everybody's children are different and they will respond differently.
But what's beautiful about this is that it opens the conversation so that you can, you know, someone else reading this book could then maybe, you know, you could build on it. Or I love how you talk about the body army and how you need to, you know, all about the germs, and I just love it. I think it's
quite basic in terms of it's all those basic big things that happen during chemotherapy, but it's just there as a discussion point for the children. And for me, writing it, and my eldest and my youngest did some pictures. It was a really nice way for them to get involved, and again, more discussion.
Yes.
Well, you need to draw this because such and such, and it opened up so much for us.
Yeah, I think well, I love this all, but I love the part where it's not something we can catch or anything we have done. I think that's something huge for kids, that they think that something it might have been something that they have done, or was it because I was naughty last week, or or is it going to happen to them? And it's because suddenly you're talking about mortality and illness, and you know, kids often, they probably won't have seen you be sick before, or you know, those kind of things.
It's quite scary.
It's scary,
well,
and I think that you're suddenly having all of these conversations, and you're not necessarily aware of how the treatments are going to affect you, and you know, like you were saying.
And if we've got those uncertainties and lack of understanding as a 6-year-old and 3-year-old, they're, you know, exaggerated, aren't they? So. And
this, you know, the days you're going to have good days and bad, and I just it's beautiful. I think.
And do you come back to it still? Do do you sometimes bring it out and use it as discussion points again?
They do actually. They've both got a copy in their memory boxes, and I was really fortunate. The printers, Ruddocks at Lincoln, they invited us along to actually physically see the book being printed.
Wow.
All of us went along, and it was just a great experience, and it's been so positive. You know, there's nothing negative with it really.
And that they're involved in it. I mean, that's just an extraordinary.
And my eldest, they go to the library quite a lot in the village, and they went this week, as it happens, on Monday, and she said, I won't mention names, but one of her friends, she took out your book, Mummy. It's in the library, and she chose your book, and you know, it was just so lovely, and she was really proud. And I said, well, it's our book, isn't it? You know, so they do get to it, you know, get it out.
I think this is a really useful tool. The faces.
Should we show so people can see?
And this is almost like a sort of play therapy thing for children, that they can, if they might not know how they're feeling until they see this. And I think
I can't take the credit for that page. That is my fantastic friend Lucy, who did all the graphics. She came up with that, and it is brilliant. And this is my youngest's favourite page. She loves going through the faces and things like that.
So just to explain, so this is how do you feel today, and using this as a way, is this for so that you could perhaps come to this and say, actually, I'm feeling like this today, and pointing and explaining? Yeah,
or for my children to say, you know, how are you feeling about it today? Or how are you just feeling in general, just to get discussions going, really.